So I think we are going to start directly with the training, right?
Yes.
Okay. So hopefully today we may have more participants coming to the forum, because somehow just now today I shared the event in my Facebook. So you know, when you see my Facebook, it's include the European region distributors, so hopefully they will also join. But we also can see here Dr. Charles Wana from Toronto, Canada, also already tuned in. Welcome, Dr. Wana, and welcome everybody. Is hopefully everybody's doing well. So, and also I would like to welcome our South Africa, Johannesburg General Manager, Mr. Glory Guo. Thank you for the opportunity. Thank you for all the support to these trainings. So the intention of this training, actually, we want to provide more education for our distributor. Okay, so how can you grow your business big if you don't know anything? So yes, we have to equip ourselves with more and more knowledge, not only in business side, not only about how to make money, but also about the products, about the health. So there are many things to learn. But when you learn a lot of things, it will guarantee you to be, you can get faster to get your success in grain work. Okay. So today we are going to have two topics. Number one is about COVID-19, okay, the relation of COVID-19 with cardiovascular challenge, and also we will see how the zinc play the role to inhibit the COVID-19. Okay, so this is a very important issue for now, since we are still not over, still far from over. We are still waiting for the vaccine. We are still not sure about the perfect medication. So now we are trying to open more information for everybody. So how Green World can help to take care of this COVID-19. So I will start to share my screen. Okay, just a moment. Okay, now everybody can see the screen. The screen is on.
Yes, we can see. Continue.
Okay. Okay, now let's see. This is the topic is COVID-19 update with the infected endothelial cell in blood vessel. What is endothelial? What is how COVID relate to this endothelial cell? Then let us learn together, because this is quite important for everybody. So now, before we go further, let us see right now. This is the latest data which I get from WHO. Latest data on August 18. In August 18, the recorded data from WHO is globally there are 21.7 million people already infected with this COVID-19 coronavirus. And from this 21.7 million, there are 770,000 deaths from all over the world, and newly cases found in the last 24 hours is around 200,000 new cases. So it's still a very high situation. We should also be very careful, because COVID-19 is a real thing. Okay, so now let us see. This is the top five infected countries in the world. Number one is America, United States of America. Number two, the second one is Brazil. Third one is India. Fourth one is Russia Federation, and the fifth is South Africa. Well, it's surprised us that South Africa can become the fifth. So we, especially to our distributors in South Africa, please be more careful and please share this knowledge to your society, your people, for them to have to be more careful to take care of themselves, not to get infected by this COVID-19. Now let us see here. This is the updated African region data of WHO on COVID-19 in Africa especially. So in Africa, South Africa is the number one, Nigeria is the second one, Ghana, Algeria, and Kenya. Now in South Africa, the infected, the cases, total accumulative cases is already reached 587,000 people with 11,839 deaths. So it doesn't mean that other country is much better than South Africa. For example, I can say like Nigeria. The problem here in Nigeria, the government did not do any tests to the citizen, to the people. So we don't know who and who. We don't know. So the government of Nigeria, they are just waiting. Anybody that get infected, then come to the hospital, and everything is too late. So here actually, like I can say, because I'm in Nigeria now, it's more scary to be in Nigeria compared to in South Africa, because I believe in South Africa, the government is a bit more active to do more tests to the people. So somehow we need to keep spreading the news, spreading the information, the correct information to the people, that they should put this thing more serious, try to protect their family, because coronavirus is still, there is no cure until today. So now about the signs and symptoms of COVID-19, signs and symptoms. If anybody start to feel something wrong with the body, with your body, okay, like you start having fever, and then maybe dry cough, and then flu-like sneezing, and maybe sometimes follow with vomiting, and sometimes some people follow with the diarrhea. So if you start, one day you start feeling this kind of sign of symptoms, do not wait, okay? The problem, the biggest problem where people mostly died because of this COVID-19, because they just think this is a common, this is just maybe just a common fever, not a COVID-19. So it's somehow when they just ignore this for a few days until they get the problem is getting worse. So then they will rush to the hospital, and it's too late. When it's too late, then you have to use all this breathing breathing support and everything, and we can say it's too late. So anytime when you just feel like, why today I'm not feeling well, I feel fever, my temperature is very high, and then I feel itchy here and somehow like want to cough, dry cough. So this is the sign. Don't panic. Don't panic. Just immediately go to the hospital or go to the CDC center, the chronic disease center. So to get yourself a test for the COVID-19 to make sure you're positive or negative. If you're positive, don't panic, okay? Because when you're panic, your blood pressure will increase, the immune system will drop down. So just stay calm, okay? Just follow the direction given by the official what to do. Okay, you just follow. Maybe you need to be isolated, this and that. You just follow, and they will give you medicine, and also maybe you can take some of the products also to help to give support to increase your immune system, and then to give good nutrition for your body, like you take vitamin C, you take multivitamin, you take spirulina plus, or maybe you take a blueberry juice. This will help to increase your immune system. Maybe you also take a Ganoderma and also cordyceps, and maybe you can drink clear lung tea. This all thing is supporting your body to fight the virus. So don't get panicked when you positive with this virus. Just follow all the procedure, and you will be okay. You will be okay. There will be so you don't have to be worried. So now again, we have to follow the global safety standard. Please wear face masks. Every time you go out, wear face masks. Okay. If possibly, maybe you can wear the face cover, the face cover. Okay. Try to protect yourself because okay, maybe you are strong enough to face this COVID-19, but when you are get infected, you go home and you start together with your children, which is they are still very young, or maybe you have your mothers or your fathers which is quite old. They are not as strong as you, so they will get the bad effect of this COVID-19. Okay, maybe as an adult, our immune system is quite strong enough, but for small children and for elderly people, this is quite dangerous for them. So try to every time wear a face mask. And when you wear a face mask, don't put it down, put it up, put it down, put it up. Don't put on your chin, okay? Just make sure you cover your nose here all the time. And then remember, outside, the easiest place you can get infected by the virus is the hand door. What do you call it? You know, every door there is when you want to open the door, there's a handling. This handling is the most risky place where the virus will be there. So be careful. Just be aware of this. And then also, after you go out from anywhere or in outside, if you found any toilet or if you found any place that you can wash your hands, just keep washing your hands. Okay, just keep washing your hands, and when you come back also wash your hands, and then try to take a shower with soap. So this is to minimize the spread of this virus, COVID-19 virus. Try to apply this for the sake of the safety of your family. Okay. So now, currently, the worldwide scientists is they are in the race on doing the research on COVID-19. Not only the research on do the vaccine, also the research on how this virus attack our body, and then why there are many people dead. So what happened with them? So many scientists try to find out actually how to handle this COVID-19. Now, this is the new updated research on COVID-19, which can infect the blood vessel. We know, we heard COVID-19 is infected lungs. Now, there is another research from this, some scientists, like this Mr. William Lee, the MD, of the president of Angiogenesis Foundation. So he mentioned, Mr. William Lee mentioned that all these COVID-associated complications were a mystery. We see blood clotting, we see kidney damage, we see inflammation of the heart, we see stroke attack, we see encephalitis. Encephalitis is a swelling of the brain. The brain is swelling. And then here another scientist also, Mr. Mandip Mehra, the MD, medical director of the Brigham and Women's Hospital Heart and Vascular Center in America, he said that if you start to put all the data together that's emerging, it turns out that this virus is probably a vasculotropic virus, meaning that it affects the blood vessel. It affects the blood vessel. Okay, so now another paper, in a paper published in April in the scientific journal, The Lancet, Dr. Mera and the team of the scientists discovered that SARS coronavirus 2, or novel coronavirus, okay, can infect the endothelial cells, that line the inside of blood vessel. So endothelial cells is the line inside the blood vessel, the wall of the inside the blood vessel. So endothelial cells protect the cardiovascular system, and they release proteins that influence everything from blood clotting to the immune response. In the paper, the scientists show damage to endothelial cells in the lungs, in the heart, in the kidney, in the liver, in the intestine, for people who died because of this COVID-19. So based on their research on the patient who died from this COVID-19, they found there are damage on these endothelial cells inside not only the lungs, also the heart, also kidney, also liver, and even intestine. Okay, so now let us see what is endothelial cells. What is endothelial cells? Now you can see here in the picture, this is the blood vessel, the artery blood vessel. So endothelial cell, endothelium is a single layer, of squamous endothelial cells that line the interior surface of blood vessel and lymphatic vessel. So this the inner line of the blood vessel and lymphatic vessel. So the endothelial cells form the barrier between vessel and tissue and control the flow of substance to and out of a tissue. Now, endothelial cells helps regulate the clot formation by sending out proteins that turn the coagulation system on or off. So when the endothelial cells disrupted or damaged, it may potentially promote the clot formation. So we can clearly see here. So when the inner lining, the endothelial line, the endothelial cells, they are damaged because of the attack of this virus, coronavirus, then it will break out open, then it can promote to start the blood clotting. So the blood clotting is the blockage of the blood vessel with all this in our blood. They are blood sugar, they are also blood fat, blood lipid, cholesterol, triglyceride. So when this endothelial damage, then all this cholesterol, triglyceride, blood lipid, even the red blood cell itself, it will start to make a clotting and until it's block the blood vessel. Now let us see how COVID-19 infected the endothelial cells. Now the coronavirus, the COVID-19, is coming from outside, enter to the body through the ACE2 receptors. ACE2 receptors. So this is the ACE2 receptors. Okay. Present on the surface of cell. The ACE2 receptors is on the surface of cells that line the respiratory tract in the nose and throat. So when the virus enter to our body, it start coming from the nose or from mouth or even from the eyes, coming inside to start infected the nose and the throat first. Okay. And then when the virus entering to the lungs, the virus appears to move from the alveoli, the air sucks in the lung, into blood vessel. So the virus, after enter to the lung, from the alveoli, the air sacs of the lung, it will find a way to enter into the blood vessel, which in this blood vessel also rich with ACE2 receptors. So the virus enters the lung, it will destroy the lung tissue. So when the lung tissue is destroyed, the tissue breaks open some blood vessel. So the blood vessel in this alveoli, it will be break open and the virus will start coming in to the blood vessel. Now the open blood vessel in the lungs will start the virus will start to infect the endothelial cells. So when the virus starts to infect the endothelial cells, it will creating a local immune response. Our body will react with the immune response and inflames the endotheliums. So the inner lining, the endothelium will get inflammation. You know, every inflammation usually in our body, it's the response of our immune system. Okay, immune system starts fighting. So when this inflammation of inside happening in the inside in the endothelium, so it will create a damage. The damage to the endothelial cells cause the inflammation in the blood vessel. You can see here the blood vessel is getting the inflammation. Then it will start forming. Then it will break open. It will damage the endothelial cells, and it will, like here, the inner lining is ruptured. Then all this deposit of the cholesterol, triglyceride, it will start combining with other substance in the blood. It will start to blocking your blood vessel, blocking your artery, totally blood clotting, totally blocked. So when this thing happens, the blood cannot flow. The blood will stuck here, and in meanwhile, this side it don't get any blood supply. Now, our heart is a muscle. Okay, the form of muscle which the heart is doing contraction. When the heart is doing contraction, definitely the muscle need the blood circulation, because inside the blood circulation, the blood is bringing oxygen, bringing nutrition. So for the contraction, the muscle of the heart needs the oxygen, need the nutrition. So when this artery is blocked, then the blood is blocked. It cannot flow to the heart muscle. And what will happen? This heart muscle will slowly start to die, and it only takes around 40 to 60 minutes, the heart will totally die. This is what happens when people get the heart attack. This is what happens when people get a heart attack, because the heart organ do not get enough blood supply, which is this blood supply is bring the oxygen and nutrition. So with this, in this case, the coronavirus create the damage of the endothelial cells. When the endothelial cells rupture, damage, it will start to make total blood clotting, which will block the blood flow to any other organs. Okay, this happened to all the other organs. Another thing is when this there's a widespread evidence of the blood clots and infection in the endothelial cells in the lung. So also this coronavirus infected the endothelial cells inside this blood vessel in the lung, in this alveoli, in the air sacs. Okay, so when the inside here the endothelial cells in the blood vessel is destroyed, then what will happen? The blood clots and infection in the lungs, it will block the gas exchange. When we are breathing, we inhale oxygen and then we exhale carbon dioxide. When the lungs air sacs, the blood vessel is damaged, So it's difficult for the lungs to do the function to exchange the oxygen and carbon dioxide. So that's why people will start getting difficulties in breathing. They cannot breathe. They will feel like they are drowned. Why they feel drowned? Because somehow when the virus is infected the lungs, the immune system will also do the reaction. It will create the reaction of the immune virus, the reaction of our immune system to fight the virus is the inflammation of the lungs, and also it will come with the pus, okay? This pus also will makes difficult for the oxygen in and out, because this pus will block the trachea also. So this, when ourselves, we cannot inhale oxygen. There is no oxygen enter to the lungs, and there is no exchange of oxygen inside the lungs. Then there will be no oxygen all over the body. There will be no oxygen in your brain. There will be no oxygen in your liver, in your kidney, in your all body organs. Then what will happen if our body organs do not get enough supply of oxygen? They will die. When our organs one by one start to die, what will happen? Then we are dead. So now that means we should try to consider, especially for anybody, maybe you are overweight, okay? Maybe when you check your blood pressure, you have a high BP, or maybe you do a blood test, you have a high cholesterol, high triglyceride. So you have to be aware, because if you have high cholesterol, if you have high triglyceride, or if you have high blood sugar level, diabetes, okay, this will put you into higher risks because this coronavirus is infected the blood vessel, the endothelial cells. We can see here. Okay, so these are all the cholesterol. So this will, if you have high cholesterol, high triglyceride, you will have the higher risk for this blood clotting is happen. So when this blood clotting is happen, it's not only you cannot breathe, the body organs do not get enough oxygen. Also, it will stop your heart from do the contraction. That means our heart will stop working, will stop beating. Okay, and when our heart is stop beating, that's it, finish. Okay. Now let us see how to maintain the endothelial cells against COVID-19. First, a healthy lifestyle. Please share to everybody, we have to have the healthy lifestyle, including exercise training. Okay, try to do exercise like riding bicycle, or just jogging or walking every morning 20-30 minutes. That's enough. And then regular intake of antioxidant. We have many antioxidant in green world. Okay, and then rich diets such as fruits and veggies. Eat more fruits and eat more vegetables. We know not only in South Africa, even in Nigeria, even in Kenya. Kenya is very famous, like Madam Lucy already told us. Nyama choma is very famous in Kenya. Okay, I also like nyama choma. I don't know in South Africa what kind of this beef or meats you like to eat this. So yes, it's very delicious, but for now, try to reduce the consumption of these red meats. Okay, try to eat more vegetables and fruits. Okay, this is to maintain your immune system level, maintain your blood circulation. Okay, and then avoiding exposure of things that can trigger the endothelial dysfunction, like smoking cigarette, when some people may be smoking weed. Okay, and then also high sugar intakes. You know, when you are having dinner, after the appetizer, then the main course, and then the dessert. Okay, so many sugar enter to your body. Okay? The dessert, you will take sweet cakes, and then you will drink Coca-Cola, you will drink soft drink, you will drink in-box fruit juice, which is very sweet, a lot of sugar. So when all this sugar enter to your body, then your blood sugar will jump out. Okay? So try to reduce not only the white sugar, but like sweet fruits or cakes, okay, chocolate. All this has a very high level of sugar. Try to limit this. And then also try to control your BP, your blood pressure, your hypertension. And then Greenworld Health Nutrition products to maintain the healthy endothelial cells. So we have here in Greenworld, tell to everyone, we have the products that can help to maintain the healthy of the blood vessel, the inner lining of the blood vessel. This is very important because when the inner lining, the endothelial cells is damaged, you will easily get stroke attack, you will easily get heart attack. Okay, so we introduce Greenworld products to them. What are the products? Now we have these products. First is Cardio Power Capsule. So Cardio Power Capsule, it can dilate the coronary arteries, increase the coronary blood flow, and then improve the cardiac output, decrease myocardial oxygen consumption, and blood platelet aggregation, prevent thrombosis. Thrombosis is the blockage, the blood clotting. Okay? Then lowering your blood and plasma viscosity. What does it mean, viscosity? Okay, our blood is a liquid. When we eat too many fatty foods, increase cholesterol, increase triglyceride. When you intake too many sweets, sugar, glucose, it will increase your blood sugar. All these three will make your liquid blood become thick. The thickness of the blood liquid, this is called a heavy with high viscosity of the blood and plasma. And then cardio power also can help to reduce the cholesterol. Then next, we also have compound coenzyme CoQ10, CoQ10, CoQ10 capsule. This CoQ10, it can prevent coronary heart disease and then relieve angina pectoris. Angina pectoris, we already learned last week. Angina pectoris is the sign of the heart attack, okay, the painful, the pressure, the squeezing pain in your chest, this is angina pectoris. And then it's CoQ10 also can regulate your blood pressure, normalize your blood pressure. And then also can regulate the cholesterol and blood sugar. Then ginkgo biloba plus capsule. This ginkgo biloba, it will dilate the blood vessel, and decrease the blood cholesterol. So all these three products is very effective to take care of the endothelial cells, inner lining. Okay, it will help to maintain the healthy of our cardiovascular system. And then also we can combine with deep sea fish oil. This is one of my favorite products, deep sea fish oil. I never let go deep sea fish oil in the last 15 years, believe it or not. Every day I take deep sea fish oil. Okay, deep sea fish oil is rich in DHA and EPA, omega-3 fatty acid. It can decrease your risk of cardiovascular disease, inflammation, any infection. Again, any virus that causes infection in the body, it will create inflammation. So the deep sea fish oil will handle this inflammation. And then also deep sea fish oil will regulate the high blood pressure and then lowering down the cholesterol and triglyceride level. Okay. And then next we have lecithin capsule. Lecithin, it reverses and prevents the damage that may arise from coronary artery disease by preventing cholesterol and other fats from sticking on the artery walls. So the lecithin will prevent the cholesterol to stick inside the blood, inside the blood vessel, in the inner lining, in the endothelial line of the blood vessel. So that means lecithin is working like a detergent. You know, when you're washing your clothes, you're using detergent, so the detergent will not let the dirt, any of these oily things, stick in your clothes. So it will separate them from your clothes. So then your clothes will become clean. All this dirtiness will be thrown out with the water. Okay? Same thing, lecithin will work like a detergent in our blood circulation system. And then lipid care tea. This is one of the best tea that Greenworld has. Lipid care tea, it will regulate blood lipid level and then control high blood pressure. You know, when I was in Pakistan in 2 years, 2018, 2019, we have 3 cardiologist doctor in KPK region, in Peshawar, KPK region. So these 3 cardiologists, they are doing clinical tests on our lipid KT. So they are giving our lipid KT to 200 patients. They are getting sampling of 200 patients with high cholesterol. So all these 200 patients, they have high cholesterol, high triglyceride, high blood pressure. So they stop the medication, the medicine, cholesterol medicine. They stop. They replace with Greenworld lipid KT. I tell them, try to give them 1 until 2 sachets, one or two tea bags in a day, and then at least try to maintain this in the first 2 weeks, 15 days. Then they do this sampling. Then they collect the data. They tell to the patient, you take this tea for 15 days. After 15 days, you come back here. We'll do the test. No need to pay. Okay. Then all these 200 patients, after they are taking this lipid KT, they are come back to this three cardiologist doctor. So they do the blood test, they do the cholesterol and triglyceride blood test, and they find out that lipid KT effectively reduce, lowering down the cholesterol and triglyceride. From this 200 sampling, they mentioned to me 85% is successful within 15 days. Lipid KT can reduce significantly the blood cholesterol and the blood triglyceride, the blood fat. So this is the good news. We have to start intake of this, especially if you like to eat the fatty foods. Okay, try to control our blood pressure, blood cholesterol level. And then another thing, that this is Greenworld products for healthy endothelial cells against COVID-19. This is, we have Spirulina Plus capsule. So this Spirulina Plus capsule is very rich in protein, amino acid. Amino acid is the breakdown of the protein. And then omega-3 fatty acid, which is the gamma-linolenic acid, And then Spirulina Plus also contains a lot of vitamins, vitamin A, vitamin B, okay, B complex, vitamin C also, vitamin D also, okay, vitamin K also. And then it contains minerals, and then dietary fiber, phytonutrients to support the health of endothelial cells. Take this. And then blueberry juice. So blueberry juice, it's very rich with the antioxidant. Inside the blueberry juice, what is the ingredients? What are the ingredients of blueberry juice? Blueberry, raspberry, blackberry, and then cherry. All these 4 berries, the most powerful berries: blueberry, blackberry, raspberry, and cherry. So with these 4 cherries, okay, the blueberry juice contains a very high antioxidant with the terpenols and then flavonoids, and anthocyanins, and also include the vitamin A, vitamin C, a very high vitamin C, and also beta carotene to protect the body cells from oxidative stress caused by free radicals. Okay, this is a very good blueberry juice. Okay, now let us see. This is how zinc. What is the relation between how can zinc prevent the spread or prevent the replication of the COVID-19 of the coronavirus? Now, COVID-19 caused by novel coronavirus, one of the RNA virus in positive single-stranded genomes and the largest number of base known. Like any other virus, the novel coronavirus have to rely on the host cells to replicate. So the coronavirus have to rely, this is the host cells, this coronavirus have to rely on these host cells to replicate. Therefore, they must first burrow into a cell and steal materials from the cells to complete their own replication. Okay? Then a laboratory study in 2010 showed that zinc could inhibit the activity and replication of another coronavirus, the SARS-CoV, which is this virus, SARS-CoV, caused the outbreak of SARS in 2003 in Taiwan, in China. And then therefore, European and American scientific research institutions, they start to include zinc in clinical trials, aiming at protecting the health and safety of the frontline healthcare. So they are giving zinc to the nurses, to the doctors, to the driver of the ambulance, okay, all the health workers, okay. They're giving them zinc, and they do these clinical trials, clinical tests, and it proves that zinc can protect themselves, the health workers, from the replication of this coronavirus. Okay, because until today, yes, no vaccine yet. Okay, yeah, maybe they are now in the last stage. Even Russia already announced, they already confirmed the vaccine and already start to supply the vaccine. But if we follow the WHO, there are still some countries like China still in the process, final stage. And then also England, also the same thing. Many countries, they are in the race of making these vaccines. So now let's see, like a master key, the spike proteins protruding from the surface of the coronavirus unlock the receptors on the surface of the human cells through binding the receptors of ACE2. So this coronavirus, to depend on these host cells, it will they have this protein which can unlock the ACE2, the receptors. ACE2 is the angiotensin converting enzyme 2. So this will open, this will convert, this will make the virus to attach to the body cells and then start to open the body cells, steal the materials for them to replicate, start to replicate themselves. Okay? Now, using such tactics, the novel coronavirus enters the cells and breaks its envelope, then release RNA into the cytoplasm, and use the mechanism of the host cells to make RNA viral genome transcribe into a new RNA. In this way, the virus makes the host cells like a replication factory. So our body cells become a factory of this coronavirus, continuously making new generation of the virus. Now, it is found that RNA synthesis of novel coronavirus depends on RNA polymerase, which which is the core component of its replication and is considered as one of the important targets of the virus. So now let us see zinc. Zinc as an inhibitor of RNA polymerase plays an essential role in inhibiting novel coronavirus replication. So zinc will protect our cells, not to let our cells for the coronavirus, allow the coronavirus to change the RNA, to make the RNA synthesis in our body cells. So by taking zinc uh, regularly, this at least, if we don't know we are getting infected with the coronavirus or not, okay? But if our body has enough zinc level, this will help to prevent the coronavirus replication become more and more inside our body. Okay? So this is the idea of the new ways on how to see the coronavirus. So now, not only taking cordyceps, clear lung tea, be careful. We also have to focus also for anybody, especially who have diabetes, who have high cholesterol, triglyceride, try to reduce, try to take some products, green milk products that can help to maintain your health, control your BP, control your cholesterol, okay? Try to minimize the risk, try to minimize the risk. Okay. So this is okay. This is the end of the trainings. Try protect our blood vessel health to lowering down the risk of the death from the COVID-19. So this is our trainings for this COVID-19. For this time being, I will return back to our host, Ms. Neronens Moyo, please.